So the issue for us as practicing physicians is not whether or not the external environment is going to change. It's just really whether or not we're going to lead that change or react to that change. And I think one of the great things about the Center for Transformation and Innovation is the ability to give us the skill sets to understand what we need to do to lead that change. I'm a practicing physician with a Wharton MBA that leads a large health system, and the kind of things that you're learning or you will be learning on a day-to-day basis from CTI are exactly the kind of things that you need. Just like you learn a new procedure. You wouldn't consider doing a new procedure that just got invented without really training on that. Well, the healthcare system we're about to enter is really being reinvented. And I think the goal is to make sure the physicians have the skill sets to be able to, if you will, operate in that reinvented healthcare system. I'm excited about a physician and nurse-led, provider-led operation and a physician-led future where the docs are basically excited and optimistic about a different future as opposed to hoping that nothing changes. I lead an organization that if you ask any of my physicians or nurses, what do you think about the future? And instead of our sphincters tightening and talking about the Affordability Act or any of those things, we'll say we're optimistic about the future because we're looking at a future where we're selecting and educating physicians differently, because we're starting to look at how we assess technical and teamwork competence. We're looking at the things that are going to be obvious 10 years from now and starting to do that today. I think you can do that in your hospital. I think you can do that in your practice. You can say, what's going to be obvious 10 years from now? We're getting into politics. And what can we start doing today that really puts us ahead of the pack? That's what's exciting about the world we're living in. That's what's exciting about CTI. And that's really what's exciting about the medical profession. We know more than anybody else about what the right way to do things. Let's take that innovation around the clinical skills and turn that into innovation in a new and exciting strategic and business environment.